So tell me, so patients who come to you, coming on just a little bit, I just want to touch on prevention in a way. So if, is it the same concept? You use sunscreen and that is preventative, that can be a preventive agent for this
that's
disease?
what we typically will recommend to these individuals as well, is appropriate sunscreen measures, at least an SPF 15, preferably 30 or higher. Appropriate sun protective measures such as, when you're out, a wide-brimmed hat or preferably long-sleeve ultraviolet protected clothes. These would be things that we would typically recommend patients, particularly if they already meet the clinical phenotype. So the clinical phenotype classically would mean somebody who's fair-skinned, blue eyes, blonde or red hair. These are individuals
just
who
like
are
me,
much
I guess.
or us, both of us.
I need SPF 100, I think so, right?
So these are patients who are, or individuals who are at much higher risk of developing skin cancers. Now, once they already have a skin cancer, they actually have a higher incidence of developing a second non-melanoma keratinocytic cancer, almost a 40% increase. And if they've already had one more, it's almost an 80% increase. So these are patients who've already had what we call the field cancerization defect because of chronic, for example, UVB exposure. I think one thing that I really would like to stress, it's not just ultraviolet B, it is ultraviolet light A as well. And sometimes that is actually sort of under-recognized because ultraviolet light A, for example, is what we use in tanning beds and tanning salons. So again, as a public health measure, it's important to recognize that tanning beds do increase the incidence of development of not just melanoma, but other non-melanoma skin cancers, including CSCC. In patients who have been treated for years with PUVA light therapy, Sorolens and ultraviolet light A therapy, for example, in psoriasis, they have a higher incidence of developing CSCC as well. So these are things that we have to keep in mind and certainly educate the general public when they're going out into the sun, take adequate protection measures. One of my dermatologists who we work with very closely, he says, I just keep my ointment right at right after the shower, just put a little bit on his face. It has the adequate sunscreen. And he says that therefore at least I start off the day being protected by going out, particularly in a place like Florida.
Yeah,
so that's important.
You really need in a place like Florida. So tell me, so it's almost akin to, let's say, when smokers come to us with lung cancer and they say, should I quit smoking? It does make sense for them to quit smoking. And similarly, if patients come to you who's never used sunscreen before but have this malignancy, you say, even though we've treated you and it's gone away or it's in remission or something, you now need to start using sunscreen to prevent the second one from coming.
I would absolutely recommend that, to try and at least decrease the incidence of developing a second skin cancer. That becomes even particularly more important in the transplant population, the solid tumor transplant population, because in those individuals there's a higher risk related to cumulative sun exposure as well after the transplant and the association with immunosuppression there. So I think trying to do these simple measures hopefully will go a long way in trying to reduce the disease burden from this very common skin cancer, very treatable skin cancer in the early stages, but there's that small percentage of patients that eventually go on to developing advanced disease that becomes far more difficult to treat.
That's great. So like prevention is better than cure.